Nutritional and lifestyle factors modified the risk of epithelial ovarian cancer among Sri Lankan women. Authors are J.I.K. Hettiarachchi, A. Chandrasekara, and A.J. Hilmi. It will be presented by J.I.K. Hettiarachchi. The authors are from Faculty of Livestock, Wayamba University of Sri Lanka, and Oncology Unit, Teaching Hospital, Kandy. Over to you.
Okay. Good morning, ladies and gentlemen. I'm Jivanadi Hettiarachchi, attached to the Department of Applied Nutrition, Wayamba University of Sri Lanka. Today, I'll be sharing some of our research findings with regard to nutritional and lifestyle factors modifying the risk of epithelial ovarian cancer among Sri Lankan women, which is a preliminary case control study. Ovarian cancer is the most malignant among all gynecological cancers, and 90% of those malignant tumors are of surface epithelial cell origin, so they are termed as epithelial ovarian cancer. A woman's lifetime risk of developing ovarian cancer is 1 in 72, whereas dying from ovarian cancer ranges at 1 in 90. And globally, this cancer type accounts for around 4% of all female cancers, and it is the 6th most common type of cancer among females in the world. Taking a look at the global picture, it is evident that the incident rates are considerably higher in the European and American context compared to that of Asian context. But despite the fact that Sri Lanka is located in the Asian context, it is sad to say that we are among one of the very few countries having highest ovarian cancer incident rates in the world. So, inconsistent with these global statistics, even local statistics suggest that this cancer type accounts for around 8.1% of all female cancers, and it is the 3rd most common type of cancer among local women. And from year 2005 to year 2011, these incident rates have upsurged by double. And the other danger associated with this cancer type is that it has some vague symptoms, which often delays the diagnosis. So this late diagnosis have the survival rates, 5-year survival rates, as low as 15%. So with these evidences, it can be suggested that the therapeutic progress that we have for this cancer type is quite limited. And at the same time, the screening facilities are not routinely available for the general public. So, understanding possible etiologies and the modifiable risk factors and prevention of them plays a greater role in reducing the burden of the disease of this cancer. So, but despite the fact that Sri Lanka is having high number of ovarian cancer incidences, in literature we could not find any published research done on local women with regard to ovarian cancer. So, identifying this timely necessity and this research gap, we set our objective to find out, to investigate the dietary, nutritional, and lifestyle risk factors modifying the risk of epithelial ovarian cancer among Sri Lankan women. Our research method involved a hospital-based case control study which was conducted in the Oncology Unit, Teaching Hospital, Kandy. And the total sample for the preliminary study was 100, and this included 50 histologically confirmed EOC cases, and their age in 5-year interval and menstruation status matched 50 medically confirmed controls. So this, when selecting these controls, they had to be negative for both of these screening tests, CA125 and ultrasound scanning. And considering the sample, all sample members were around 25 to 60 years of age, and exclusions were done for those who were away from Sri Lanka for more than 5 consecutive years prior to diagnosis for cases and prior to interview for those controls. So the study tool that we used was an interviewer-administered, pre-tested, structured questionnaire investigating the following areas. And the statistical analysis was done by using SPSS version 20 at the level of significance 95%. And independent sample t-test and chi-square test were used in order to distinguish between case and control status, as well as for the estimation of risk, we used multinomial logistic regression models. Taking a look at with the results and discussion, Figure 1 and Figure 2 indicate some of the matched characteristics, the distribution of the matched characteristics of the subject. 45 to 54 age group was predominant, whereas postmenopausal group was predominant compared to that of premenopausal women in the study sample. Among the number of factors we thought to be associated with epithelial ovarian cancer in the sample, we selected these characteristics. The table 1 indicate the characteristics which were identified to be significantly different in distribution between case and control status. So there were factors with regard to diet, as well as some of the factors with regard to breastfeeding practices and several others. Taking a deeper look at the differences in dietary practices by case and control status, it was seen that the cases, higher proportion of cases were belonging to the least fruit consumption frequency group, whereas least proportion of cases were belonging to the highest fruit consumption frequency group. And following the similar pattern with regard to vegetable consumption, highest proportion of cases were having average number of vegetable varieties in the lowest category, whereas the least proportion of cases were having belonging to the highest average number of vegetable varieties consumed in their daily diet. So this indicates that comparing cases and controls with regard to their fruit and vegetable consumption, cases were approximately having considerably lower level of fruit and vegetable consumption with regard to controls. So, identifying that these factors were having a significant difference in distribution with regard to case and control status, each of those factors was considered and their individual association with the risk of epithelial ovarian cancer was estimated by using a univariate analysis. So the univariate analysis identified 8 factors to be significantly associated with elevated risk of epithelial ovarian cancer. So these 8 factors were collectively taken, and their collective association between this ovarian cancer risk was estimated by using multivariate analysis. So this final multivariate model was adjusted for the level of education and the employment status. So according to the final model, we found out that lifetime duration of breastfeeding less than 12 months, and at the same time age at menarche less than 13 years, and never use of oral contraceptives and greater body height was significantly associated with elevated risk of epithelial ovarian cancer in the study sample. Taking a closer look at the breastfeeding durations, figure 3 indicate the percentage risk reduction of EOC associated with increasing lifetime duration of breastfeeding. So taking the 0 to 12 months duration as the reference, as we move along with the x-axis, that means once the lifetime duration of breastfeeding getting higher, it is seen that the percentage risk reduction is also getting higher. So this is identified by a positive dose-response relationship. Although the relationship was not statistically significant, but this relationship was identified. So with this research findings in hand, we would like to conclude prolonged lactation significantly reduces the risk of EOC, and it is evidenced by a non-significant dose-response relationship, and at the same time, young age at menarche, greater body height, and never use of oral contraceptives was significantly associated with the elevated risk of epithelial ovarian cancer in the study sample considered. But at the same time, practice of vegetarianism, fruit and vegetable, tea and carbonate beverage consumption was not statistically significant in associating with risk of epithelial ovarian cancer in the seen study sample. So, With these conclusions, I would like to suggest that attention of local epidemiologists is needed in order to study about the local scenario and to go on more in-depth studies, maybe to validate these findings as well as to find out more dietary and nutritional risk factors. And it is a timely necessity. As a country having high ovarian cancer incident rates, I think it is a timely necessity that we investigate on this area, and possible if we could develop a tool to identify women with high risk of EOC. So with that, I would come to the end of the presentation, and my acknowledgement goes to the following figures. These are some of my important references. Thank you very much.
Thank you for the very educative presentation. The paper is open for comments or this questions. May I ask a question or two from the chair? In your study sample, did you check things like the parity,
Yes.
duration of
Yes.
lactation, and the duration of the period where they have taken the oral contraceptive pill?
Yes, sir. We investigated on those areas, parity and the oral contraceptive use. It was actually done in category-wise, less than 5 years, more than 5 years, likewise.
Was there any difference or correlation between the duration?
No, actually in here, the presentation, we highlighted the things that we could find a correlation, we could find an association with the risk. So those things were considered, but still there was no significant risk modification for EOC in the study sample we considered.
Any family history?
No, sir. Actually, in this study, we could not find the statistically significant associations were found with the menstruation age at menarche and this breastfeeding characteristics, body height, and this oral contraceptive. Never use of oral contraceptives was found.
Thank you.